Welcome to Life Heal, the future of holistic practice. So this podcast series is for holistic and complementary therapists and health coaches who are ready to evolve with the changing world of health and well-being. It is for you if you are out there trying to live your dream job and your dream purpose and are feeling that a bit disillusioned and a bit lost, and feeling that perhaps whatever you've trained in and the stuff that you're doing out there is a little bit out of date, or that you are not quite hitting the mark and it's not the idyllic life that you hoped it would be. Perhaps you feel that you're not reaching people, you don't know how to reach people. Perhaps you've got your own treatment room and you're sitting there day after day and there's no clients coming in. This podcast is for you if that is the case. So I'm Sam, integrative health coach, therapist and co-founder of Life Heal, and this series explores how integrative health, lifestyle medicine, social prescribing, digital health and multi-modality therapies are redefining what it means for holistic care and complementary therapies. Each episode is going to blend grounded insight, real-world strategies which can help you align with your own purpose and really find your position in modern healthcare and how you fit with this new healthcare that's coming in. And we're looking forward to spending time with you. If you're ready to dive in and explore the future of holistic practice, then hopefully we can keep you inspired, informed and aligned as the landscape of health continues to evolve. Welcome to episode 2, From Therapist to Integrator, Finding Your Place in Era 3 Health. So I wanted to explain a little bit more about what we spoke about in episode 1, and if this is the first time you've joined us, then there is a previous episode, so feel free to go back and listen to that. If it's the second time and you know us, then welcome and hello again. Thanks for joining us. We appreciate all of you. So this episode I want to explain, as I say, about Era 3, what it actually means, what's Era 1 and Era 2, what it means for you, and I'd like to hopefully have you leaving this conversation with a little bit of insight and a little bit of inspiration about where you fit. Where does everything you've learnt and everything that you have lived experiences, your training, all the sort of knowledge and wisdom that you've got, where does that actually fit? Where do you fit in the world? So first of all, I want to highlight that Era 3 is a huge opportunity for holistic and complementary therapies and coaches. And it can be described, if you like, as personalised integrative health. Integrative meaning that we do not treat the people, patients, clients, as parts of a system. We don't treat them in what the NHS would call as a reductionist system. So you've got a kidney pain, I treat your kidney. I'm not going to go and look at the whole system, which is what ancient medicine does. If you think about Chinese traditional medicine, Ayurvedic, they treat the whole person and believe that if the kidney is sore, it could be systemic, it could come from another area in the body, if not the whole body. So arguably, this is the issue that we have across the world at the moment, that how many people do we know where they've gone in for one thing and we found sinister or other things in other areas just by chance, or worse, they've been missed. So Era 3 is a patient-centred and holistic way of treating patients. It treats the body, the mind, the lifestyle, super important for us, and their environment, again, super important. It's multi-modality, so it combines conventional medicine with complementary approaches, so nutrition, lifestyle, stress, mind-body practices, digital health tools, massive industry emerging in digital health. And when I say that, I mean apps. My GP's got an app that we can go into now for our blood results. It's incredible. It's more technology based, so telehealth, using AI for diagnostics, remote monitoring support. social and environmental factors, social prescribing, community supports, and a lot of mental health care. So in short, Era 3 is about empowering individuals, personalised care, prevention, integrating diverse approaches rather than just solely relying on traditional medical model. So what's Era 1 and Era 2? So Era 1 was acute care, illness focused. It was a traditional healthcare model that was focused on diagnosing and treating illnesses or injury. Reactive rather than proactive. So an example, you go to the doctor when you're sick, you get a prescription or you get surgery. Era 2, chronic disease. This is prevention focused. So this emerged as chronic conditions like diabetes, heart disease, and when these became really, really prevalent. And it was focused on prevention, so lifestyle changes, management of long-term conditions. And it was basically evidence-based guidelines and a lot of population health initiatives, easy for me to say, and health education became key. So example, regular checkups, diet and exercise programs, vaccination programs, health screening. So this is what the government were actually working towards. So you can see how the healthcare, as we know it, has evolved over the years. And bringing us back now to Era 3, you can see, hopefully from what I've said there, the key here is personalised, integrative and systems orientated. It's for body, mind, lifestyle and environment. Now these are all things, I presume, that you will be able to help with. You will be trained in these things. And you'll definitely be able to help with the body or the mind if you're a coach, psychologist or whatever. But also you will have, most people that are therapists have had lived experience. There's something that's happened in their life that's made them become a therapist or become, they want to help and share that experience. For me, endometriosis, 35 operations, it was a horrendous teens and 20s and 30s I had, and I managed to heal myself from that. But I refer to that experience an awful lot because it not only does resonance happen when you share your own experiences, but it really shaped my whole life. And then it happened again when my young son got diagnosed with autism, and I climbed mountains trying to find a solution for it, which I did find, and he lost his diagnosis. So again, that was something that really drove me. And not only did it give me evidence that I could share, I have a lived experience, but it really makes people sit up and listen, really, I suppose. They're sort of like, oh, wow, like, you know what I'm talking about. And that is missing from sort of Era 1 and Era 2 healthcare, if you like. So what does this mean for you then? It's an opportunity for you to just reassess what you're offering at the moment. How are you offering what you're offering? Are you using language like this? Because when a new paradigm comes in, there's a collective consciousness that starts to emerge. And when that happens, there's new language. And language is our codes. And if you adopt and adapt to the new language, then everybody that is early adopters of the Era 3 healthcare system will resonate with you and be like, oh, this person knows what they're talking about. They're talking about functional medicine or lifestyle medicine or the body, the mind connection, somatics. All of this language, this is the sort of thing we need to be educating ourselves on. Telehealth, what could I do in my practice to modernise it, I suppose? Can I use an app? Eric and I, our Life Heal University is an app that people can go on and study and learn and have meditation. So we have had that for quite a few years. Are you still using pieces of paper for your consultation? Is there quizzes? Is there other things you could do? So have a think about it. And then also social prescribing. How and what could you social prescribe? Now, just to recap, if you haven't listened to the first episode, social prescribing is, and people, you can get a master's in degree in social prescribing now, and it is a person that sits there and listens to your health story and says, you need to go to this diabetes group, you need to go and do to this gym, you need to go and do this, and they prescribe lifestyle medicine, basically. And the idea is to take the pressure off the GPs and the doctors' surgeries and medical centres, but also to empower, thinking of Era 3, empower the patients. And it's so, so important, because if people are invested in their own health, they're accountable to themselves, but also this other person that is their coach, if you like. So there's a lot of therapists that I know that are actually moving into coaching and health coaching and social prescribing, community support, doing groups of, say you've got 3 or 4 clients that come to you that are all going through menopause at the moment. Could you set up a menopause group? And it can be online if you prefer, or you can do it in your local community centre. Era 3 is, even though it's super, super advanced, people are coming away from the hospitals and the GPs and the medical centres, and they're going back to community, back to wartime, where everybody was supporting each other. And the community and the volunteers and everybody was supporting everybody. I got invited to do a sound bath at the MS Society the other day at our local community centre here, which is a Quaker community centre in Glastonbury, or in street near Glastonbury. And these people said to me, the girls that ran it, incredible people, lovely souls, they said to me that they had inherited this group and they'd been doing it for years and they couldn't get out of it, because this group was a lifeline for these MS sufferers. Could you do something like that? Could you put together something that is for the community? Now, what I would say is, obviously you do need to make money, I appreciate that, but what we found in our community is that the local parish have got a fund. It's not huge, but they have a fund where they will support people that are running these things, and they don't get a lot of money. You will be paid for your time and any resources that you need, so teas, coffees, paper, I don't know, whatever it is you want to do, but you will be paid for your time. And if you think about it from a business point of view, if you've got 10, 12 people in that room, they're all part of a family. And if you do a good job and you make those people feel seen and heard and listened to, then you really are having access to entire families, and that is, families make communities, and this is how we're going to be able to support. So that is Era 3. I'd love you just to have a think, as I say, about what it is that you could do. What is it you offer? What could you change? If you are a bit daunted by this, drop me a message. I can certainly see if I can help. But I'm hoping there's a little fire in your belly. I'm hoping that you're going, okay, there's something inside me. I'm not sure what it is, but I'm excited. I was a bit lost. I was feeling a bit isolated. I thought, I've mucked this up and I've picked the wrong thing. I should have done this. I should have stayed at my bank job. Whatever it is you've had and whatever part of the journey that you've been on, the time is now. We are evolving. It's exciting. And I've been through it as well. And when I was doing my degree and I came out of my degree and I'm like, yep, I've got a degree in integrative health. Here we go. I'm going to be able to help. Nobody had a clue what integrative health is. If I go into the NHS with that degree, they don't have a clue. They won't even talk to me. So it feels useless. And I also was disillusioned and I thought, what have I done? But we need to bide our time and we need to get ready and we need to prepare. And what we can do is stop thinking we're going to go into the NHS and try and save them or support. That's not our job. We are healers and therapists. We offer therapeutic care in a completely different way from nurses and doctors and surgeons. And that's great because they are amazing at what they do and utmost respect to them. But what we do is also amazing and it's needed. And it's only going to take people like you standing up for what you believe in and have that fire in your belly that you had when you decided to train in whatever it is you've trained in. Where has that gone? Find it and then apply it to what I've just said. Thinking about Era 3, how can I change my practice to be more modern? How can I change what I do? So hopefully this little short podcast has helped you a little bit, just giving you a little bit of food for thought. We're going to be delving deeper in further on in more episodes about how you can actually do this and really get you thinking about, where your place is within all of this And yeah, I hope this has been of interest, and thank you so much for joining me, and I shall see you soon. Just a quick one before we go. If you have enjoyed this podcast, you'd like to connect with Erica and myself and be part of our community, Life Heal. We're on Instagram and on Facebook as the Life Heal Journey. We've also got a website where you can find lots of free resources, blog posts and things like that. You're more than welcome to look us up. It's www.lifehealjourney.com. We have a Facebook group with over 1,000 people in it and beautiful souls, and you're welcome to come in and have a look around and chat to people. That is Life Heal Lifestyle. And then finally, if you want to deep dive a bit more thoroughly, then we have lifehealuniversity.com, and that is our online platform, and it's a subscription platform. It's £27 a month, and you get lots of different courses, meditations, there's a book club, and it's just a little bit more serious than the Facebook group. So you're welcome to reach out to us in any way you like. There is a contact section on our website, so if you've got any questions, we love to connect with people. So feel free to message us, give us a shout with your story, and we look forward to seeing you in the next episode.